Herniated disc occurs when the outer part of an intervertebral disc deteriorates and the inner part protrudes, compressing nearby nerves and thus causing pain. An intervertebral disc acts as a shock absorber between the vertebrae, allowing movement of the spine. The external part of the disc, the annulus fibrosus, contains the gelatinous inner part, the nucleus pulposus. Most herniated and protruding discs occur in the lower back or lumbar region. Any contact between the nerves and inflammatory proteins present in the core of the disc, or pressure exerted by the disc itself on the nerves at the bottom of the spine can cause sensations of pain, numbness, tingling, or weakness that radiate down the leg. These symptoms are commonly known as sciatica. A hernia in the cervical region can cause pain radiating from the shoulder to the arm and fingers, as well as other neurological symptoms. One of the most effective treatment strategies in the case of herniated discs is ozone therapy, which involves the infiltration of a mixture of oxygen and ozone. With the classic paravertebral technique, the points of administration are identified in relation to some cutaneous and bone references. The infiltrations are performed, however, inside the muscle a few centimeters away from the hernia. So, this approach is not very precise and the ozone must therefore be administered in several points, which requires at least 10 to 12 sessions. Pound-guided ozone therapy is instead a very precise technique and can be considered as the evolution of the paravertebral technique. The use of radiological equipment allows personalization of the therapy by using needles of the most appropriate length, which always penetrate to within a few millimeters of the hernia and the inflamed nerve. For each intervertebral disc with a hernia or a protrusion, only 2 needles are placed, one on the right and one on the left. After the first needle has been positioned, a radiological assessment is performed allowing the possible correction of needle positioning. The same procedure is followed for the second needle. Once the correct positioning of both needles has been achieved, ozone is administered just a few millimeters from the intervertebral disc and the inflamed nerve that is causing pain. The guided technique thus allows the ozone to perform its anti-inflammatory action perfectly, thereby gradually reducing the effect of inflammation-mediating substances. Also, in many patients, a progressive reduction of the volume of the hernia has been observed. The extreme precision of the guided technique also means greater safety and increased effectiveness, as it allows greater success rates to be achieved in the treatment of hernias, protrusions, and all kinds of arthritic pathologies in just 4 sessions.